The Buddha was sitting underneath the Bodhi tree when he attained the enlightenment of impermanence, that it is our attachment to things that will not last that brings us suffering. Our bodies, these vessels that we inhabit for the time on this earth, are impermanent. Mine just happens to be heading towards impermanence a lot faster than others. I am Sarah E. Kucharski. I am an intimal fibromuscular dysplasia patient. Many of you may know me better as AfternoonNapper, which you can find on Twitter. My personal healthcare blog is the Afternoon Nap Society, where I focus on patient relations, my own experience, just really trying to share what I know to improve patient communications and the inpatient experience. I also am the founder of FMD Chat, which is a peer-to-peer global support group for those affected by fibromuscular dysplasia. We don't just focus on patients, although that's our primary goal, but we also welcome the family, friends, caregivers, even healthcare providers, so that they can learn about this disease. So what is fibromuscular dysplasia? It's a rare disease, which explains why you probably don't know about it and probably can't spell it. It's a vascular disease in that abnormal cell growth causes the artery to narrow. Education is something that I try to make a part of what I do. So the primary form of FMD, as it is known in short, it affects different layers of the arterial wall. The primary form affects the middle layer, and it's characterized by a string of beads appearance upon angiogram. My version of FMD, the intimal version, is the rare version of the rare disease, so that less than 10% of cases of FMD are like mine. I know 7 people in the world who have what I have. That doesn't necessarily mean that there are 7 people, period, but those are the ones that I've been able to track down using social media so far. Symptoms of FMD may include migraine-like headache, dizziness, pulsatile tinnitus, aneurysm, artery dissection, hypertension, stroke, or TIA. Some of these symptoms are obviously a little nondescript, a little vague. They're not something that you would start looking for vascular problems on early on in the stage. This poster is one that we've had designed for us exclusively, and it's actually on display in the exhibit hall. Me and my FMD, the story's kind of a long one. I started out early on with symptoms of GI distress. I really couldn't eat. It was the kind of pain that would leave me sleeping on the bathroom floor because I couldn't be away from a bathroom for long enough. But I just thought it was normal. It was something that I accepted as being just what my body did. It ended up being that I had this fear of food, and my family would often refer to me as sort of being a boa constrictor, that I would eat when I could, but there would be days upon days that it would be just a few bites here and there. And living with an invisible illness, because it's this vascular disease, I mean, there's no real appearance of it, and so it's hard to convince people exactly what you have, that you are suffering, and that this impacts your day-to-day life. When I was a senior in college, my blood pressure just spiked out of nowhere. It was historically very low, and then all of a sudden I'm posting 220 over 110. The blood pressure failed to respond to medication. I really couldn't do much about it because I was a senior in college. I graduated, I moved. There was this delay in treatment until finally 3 years later, I'm at work and my left arm goes numb. And I think, I'm gonna have a stroke. And so finally, I go to my family doctor and we try medications and it still doesn't do anything. And he says, there's this really weird thing that I want to have you tested for. He'd had one other patient his entire career who'd had renal artery stenosis, that it's the narrowing of the artery that leads to the kidney. And when the blood supply is cut off, the kidney emits the chemical renin, which raises the blood pressure. So when we ran that test, we found out that indeed my left renal artery was more than 90% stenosed. In addition, my celiac and my mesenteric arteries were completely occluded, which explained all the GI troubles that I've been having for so many years. But no one had ever thought to look for a vascular reason to explain GI distress. So the next several years were very busy. I had bypass surgery for my renal, celiac, and mesenteric arteries in 2005. I was 25. I was obviously the youngest person on the vascular ward. The nurses enjoyed me. I was a little bit more interesting than most. One of the good things that I got out of it was my husband, who he finally responded to my pleas to actually hit on me, because we had been friends for a long time, but he'd been very shy. And it was a good thing that he responded, because he did eventually marry me, and that gave me someone to be a caregiver. Because in 2008, while I was at work on deadline, everything went weird. And I slid my way along the file cabinets at work back to my desk and said, something's not right. I went from one hospital to another hospital, was treated for my age instead of my disease. The stroke was completely missed, despite spending a week in the hospital. And I went home not knowing what the problem was. And so after that, I spent 6 months unable to work, came home on a walker. This photo that you see is actually me in the hospital with my walker. It's very snazzy. My blood pressure ended up rising again. We found out that the bypass had failed. I ended up losing my kidney. But I still went to graduate school because I wasn't about to give up. And things just kept happening. After losing the kidney, we discovered that I had 4 brain aneurysms. But then I got promoted at work, and so I'm still busy and I'm still working and I'm still trying to do all of these things, but my health is continually taking a toll. And finally, again, at work, on deadline, I suffered a gastric rupture, which led to emergency surgery, which led to more time out of work. But that was the last straw that really pushed me to get a diagnosis to this thing that had impacted my life so incredibly much, because for 31 years, I'd just been this unlonely freak that had no answers and had no one to talk to, and there was no one like me. And so finally, we went to the Cleveland Clinic. We got the diagnosis of the intimal FMD. And even though it was a bad answer, it was an answer that I knew what it was and that I could work with. And so from that, I started the FMD chat, which with its global resources has been able to reach out to others and give me a family, a group of people who I can discuss what has happened to me and hear what has happened to them, and we can be honest with one another. That we tell each other things that we haven't even told our family members because it's too intimate. And that's really why I went with the digital media. It's the finding people around the world that you connect with, particularly in the rare disease community, that helps bridge the gap across healthcare for patients, doctors, caregivers, and everyone involved. So thank you.